Hello, I'm Lavanya. Welcome to PeacePal.in. We are here today to learn about teenage mental health and self-harm. Let's embark on journey to learn about mental health and self-harm on a deeper level. First topic for today is mental health in teenagers. Adolescence is a crucial period for developing social and emotional habits important for mental well-being. These include adopting healthy sleep patterns, exercising regularly, developing coping, problem solving, and interpersonal skills, and learning to manage emotions. Protective and supportive environments in the family, at school, and in wider community are important. Multiple factors affect mental health. The more risk factor adolescents are exposed to, the greater the potential impact on their mental health. Factors that can contribute to stress during adolescence include exposure to adversity, pressure to conform with peers, and exploration to identity. Other important determinants include the quality of their home value and relationships with peers. Violence, especially sexual violence and bullying, harsh parenting, and severe and socio-economic problems are recognized risks to mental health. Let's explore some facts about teenage mental health. Globally, it is estimated that 1 in 7, 14%, 10 to 19 years old experience mental health conditions, yet these remain largely unrecognized and untreated. Suicide is the fourth leading cause of death among 15 to 29 years old. Globally, 1 in 7, 10 to 19 years old experience a mental health disorder, accounting for 13% of the global burden of disease in the age group. It is estimated that 3.6% of 10 to 14 years old and 4.6% of 15 to 19 years old experience an anxiety disorder. Depression is estimated to occur among 1.1% of adolescents aged 10 to 14 years and 2.8% of 15 to 19 years old. Conduct disorder involving symptoms of disruptive or challenging behavior occurs among 3.6% of 10 to 14 years old and 2.4% of 15 to 19 years old. Types of mental illness in teens. The most common mental illness in teens are: first, generalized anxiety, excessive worrying about everyday matters. Second, social phobias, severe feelings of self consciousness and insecurity in social settings. Third, depression, persistent feeling of sadness, anxiety, and or emptiness. Symptoms of generalized anxiety disorder include feeling restless, wound up, or on edge, becoming fatigued easily, struggling with concentration, experiencing irritability, feeling muscle tension, having difficulty keeping worry levels under control, struggling with sleep, such as difficulties falling asleep or staying asleep, or not feeling well rested. Social anxiety disorder symptoms include: first, feeling very anxious at the thought of being around others and struggling to talk to other people, experiencing extreme self consciousness and fear of humiliation, embarrassment, rejection, or offending people, worrying about being judged, feeling anxious days or even weeks ahead of a social event, avoiding places where other people will be, struggling to make and keep friends, blushing, sweating, or trembling around others, experiencing nausea and other people. Further, the signs of depression include feeling persistently sad, anxious, or empty, experiencing hopelessness or pessimism, struggling with irritability, feeling guilty, worthless, or helpless, losing interest in hobbies or activities that used to be enjoyable, struggling with fatigue or lack of energy, moving and or talking more slowly than usual, feeling restless, struggling with concentration, memory, and or decision making, experiencing unexplained changes in appetite or weight, having thoughts of death or suicide, unexplained aches or pains that don't go away when treated, while at least some of these symptoms generally have to be present for several weeks or months before an accurate diagnosis can be made. Sometimes even just 2 weeks worth of symptoms is enough to consider a diagnosis. Managing mental illness in teens. There are a range of options for treating mental illness in teens, including identifying stressors, such as not getting enough sleep, skipping meals, or generally lacking a day to day routine, and remedying them. Counseling, which is more often paired with medications. Prescribing psychiatric medications like selective serotonin reuptake inhibitors SSRIs, which are commonly used, very safe and highly effective for depression, anxiety, and social phobias, he says. Now, the main topic for today is what is self harm? Self harm, also known as self injury, self mutilation, or self abuse, happens when people hurt themselves on purpose without intending to kill themselves. Medical experts often refer to cutting and other forms of self harm as non suicidal self injury or NSSI. What is NSSI? NSSI, non suicidal self injury, often simply called self injury, is the act of harming your own body on purpose, such as by cutting or burning yourself. It's usually not meant as a suicide attempt. This way of self injury is a harmful way to cope with emotional pain, sadness, anger, and stress. The myths about self harm you should know about. Here's a partial list of misconceptions that professionals hear. Cutting is the only form of self injury to worry about. Self harm is usually due to suicidal thoughts. Kids or teens who self injure are just seeking attention or being dramatic. Girls are the only ones who self harm. If I ask my child about self harm, they might be tempted to try it. Kids and teens grow out of self injuring behavior, so what is the point of treatment? Further, the symptoms of self injury may include scars, often in patterns, fresh cuts, scratches, bruises, bite marks, or other wounds, excessive rubbing of an area to create a burn, keeping sharp objects or other items used for self injury on hand, wearing long sleeves or long pants to hide self injury even in hot weather, frequent reports of accidental injury. Difficulties in relationship with others, behaviors and emotions that change quickly and are impulsive, intense, and unexpected, talk of helplessness, hopelessness, or worthlessness. Further, the forms of self injury. Self injury mostly happens in private. Usually, it's done in a controlled manner or the same way each time, which often leaves a pattern on the skin. Examples of self harm include cutting, scratching, or scrubbing with a sharp object, one of the most common methods, burning with lit matches, cigarettes, or heated, sharp objects such as knives, carving woods or symbols on the skin, self hitting, punching, biting, or head banging, piercing the skin with a sharp object, inserting objects under the skin. Most frequently, the arms, legs, chest, and belly are the targets of self injury. But the area of the body may be a target, sometimes using more than one method. Causes. There is no one single or simple cause that leads someone to self injure. In general, self injury may result from first, poor coping skills. Non suicidal self injury is usually the result of the inability to cope in healthy ways with stress and emotional pain. Second, difficulty managing emotions. Having a hard time controlling, expressing, or understanding emotions may lead to self injury. Self injury may be an attempt to first, manage or reduce severe distress or anxiety and provide a sense of relief. Second, provide a distraction from painful emotions through physical pain. Third, feel a sense of control over the body, feelings, or life situations. Feel something, anything, even if it's physical pain when feeling emotionally empty. Express internal feelings in an external way. Communicate feelings of stress or depression to the outside world. Punish oneself. How can you help a teen practicing self harm? That's an important question, and that's something that you should know. First, have the conversation. Don't be afraid to ask a teen if they are engaging in NSSI or others who are. Take a non judgmental position, listening more and speaking less. It's okay to admit that the subject is tough for you, but express your love and concern. This is hard for me to even think about because I care about you and want you to be healthy and safe always. Say that. It will definitely make a difference. Second, Be prepared for strong reactions because people who practice NSSI often deny it and try to hide the evidence. Your child might be upset or refuse to talk. In a calmer moment, tell them that you're worried they might be self harming and plan to talk with their doctor about it. Encourage them to be there for this conversation, but even if they won't go for it, make the appointment. Make your environment safer. If the child is self harming, you can help by removing hazards such as sharp knives, razors, poisons, weapons, and more from your space. Though it can be difficult to remove all items all the time, it is especially important if the child lets you know that they are having thoughts or urges to self harm or during difficult, stressful periods that could trigger these thoughts or urges. It is also important to keep firearms inaccessible and all medications locked away, especially if the child is having suicidal thoughts. Fourth, change the way you think about social media. While digital channels may not be direct cause of NSSI, excessive screen time can lead to poor sleep and exaggerated feelings of envy, isolation, fear, and self-rejection. These issues may feed the powerful emotions that prompt some kind to self-injure. So it's worth the time to establish a healthy family media plan. Fifth, prioritize family mental health and relationships. If your family faces consistently high levels of stress, take time to consider how you can turn this around. Young people need to know that they can ask for downtime without guilt and that self care is a priority above mountains of schoolwork and extracurricular activities. Sixth, some children and their family members are at higher risk of mental health challenges due to trauma, violence, unstable family dynamics, and poverty that are part of their everyday lives. A supportive parent child relationship can serve as a powerful buffer. Talk with a professional about other ways that may help reduce stress and build resiliency for kids exposed to adversity. Share what you know. A child's well being depends on the support of family, teachers, coaches, and many others. So don't keep their struggles a secret and share what the child allows or what you think is important. If you're wondering how to disclose the child's NSSI in a way that respects their privacy as much as possible, ask a professional for guidance. It is important to remember that self harm doesn't mean the child or teen wants to die, and it does not mean that you are a bad parent or a guardian. As with any health issue, you can help the child recover by expressing hope, embracing treatment, and making sure they feel your loving, unconditional support. Further, you can check out our website peacepal.in for detailed information on various topics through alternate videos and daily blog posts. You can also check out our store section for various courses, packages, appointments for therapies, and self help books because together we can make a difference.